So if you think about this disease where you're just taking too much sugar, your body will store some of it, but when it gets too much, then what it has to do is it activates a process called de novo lipogenesis, which is de novo means from new, lipo is fat, and genesis is the creation. So it's the creation of new fat. Essentially, you're taking sugar, which is carbohydrates, glucose, and you're turning it into fat, and that's what happens. So your body protects itself, right? If it overloads, say you eat, a big plate of spaghetti, 3 times in a day, you've overloaded your body with a lot of glucose. But if you're relatively healthy, your body will simply turn some of that into fat, and you're still okay. The problem is when this goes on chronically, what happens is that your body takes the glucose, it turns it into fat, and then from the liver has created this new fat, right? That's the de novo lipogenesis, and it's going to shoot it out into the blood because it doesn't want to hold on to the fat. The liver is not an organ that's supposed to store fat, so it pushes it out as triglycerides. So triglycerides go up and HDL goes down. And then other parts of the body are going to have to take up the fat. So fat cells or adipocytes are supposed to take up the fat. But when there's a lot of it, then a lot of the abdominal organs and the fat around the abdomen start to take it up. And that's where you start to get the increased abdominal circumference. So you start to get that sort of big belly. And this is something that you do see in a lot of Asians. Because their muscle mass tends to be lower. Some of them are quite skinny looking, but then they have this large abdomen filled with fat. So they actually have a fair amount of this metabolic syndrome already happening, but you wouldn't know it just from the weight. You could only see it if you look at the distribution of that weight. So what happens is that the body's just trying to cope with all this extra fat. So eventually some of it just gets stored in the liver. You get this fatty liver. Some of it gets stored in the fat around the organs, which is called omental fat, and you get this increased abdominal girth. And then some of it gets deposited also in the pancreas, which you can also see in ultrasound. So people start to talk about fatty pancreas. So the pancreas, as it sort of gets filled with fat, eventually gets, so the insulin's going up and up and up as the pancreas is trying to deal with all the glucose. But when it gets all clogged up with fat, it actually starts to dip, and that's when you see the diagnosis of type 2 diabetes. So people used to assume that the pancreatic, when the insulin started to fall, that was the pancreas was burning out, but it wasn't really burning out. It was just clogged with fat. So if people lose weight, what you can show is that the pancreatic function starts to return as you sort of unclog the pancreas's fat. And you might ask, okay, so why does this happen? And the answer is probably that the body is extremely smart. So as the pancreas gets clogged up with fat, what happens is that the insulin starts to dip. The glucose in the blood starts to rise because the insulin is no longer able to shove all the sugar into the cells. As the insulin starts to fall, the blood glucose starts to rise, and then you start to pee out all this extra sugar because there's a certain threshold in the kidney above which you can't reabsorb the glucose. So you're actually starting to dump out this glucose into the urine. And so you might see it in terms of the symptoms. You see this excessive urination. You have a lot of thirstiness because people are trying to drink water because they're dumping all this glucose in the urine. But if you think about it, it was actually all a protective mechanism because the body sensed that there was just too much glucose. Your body's overloaded with glucose. So the solution it came up with is to slow down the pancreas and let it dump out all the glucose. Yes, you have other problems that go on when that happens, but it's a solution to the underlying problem of excessive glucose overall.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Insulin's pushing harder, it's pushing harder, it's pushing harder, but at some point it reaches its limit. And then, no matter how hard insulin pushes, you can't shove any more glucose into that cell. And therefore, that's when the glucose winds up in the